Hello, everyone, and welcome to another episode of Child Abuse Awareness for Darling J. Clark. Be a part of the solution instead of part of the problem. Copyright disclaimer under Section 107 of the Copyright Act of 1976. Allowance is made for fair use for purposes such as criticism, comment, news reporting, scholarship, and research. Fair use is a use permitted by copyright statute that might otherwise be infringing nonprofit, educational, or personal use till it's valid in favor of fair use. Matthew 18, verse 10. Take heed that ye despise not one of these little ones. For I say unto you, that in heaven their angels do always behold the face of my Father, which is in heaven. And of course, we want to get down here to that learn to do right, seek justice, defend the oppressed, look up, take up the cause of the fatherless, plead the case of the widow. Hello, everyone. Please come in and say hello. Hi there, Bucket List. Glad that you're here. Hello, Chris. Hi, Jackie. Good to see you too, sister. Lots of love to y'all. So I had this little um, thing at YouTube where this lady was sharing her story, and somebody said and asked, "How could you be so young and you remember something?" So it can't be true because there's no way you would remember. And I want to reiterate something like when that happened to me when I had earlier memory, I was told that by somebody too, but my counselor said, when something traumatic happens to you, your brain takes a picture of it because it's so devastating. It leaves an impression there. So, and then it files it away. You never know when it's going to crop up. You never know when it's just going to come back and let you know. Hello, Karen. Good to see you. Hope you're doing good. Everybody, please hit the thumbs up. So now let's discuss signs, symptoms. Oh, thank you. Love you too, my friend. Appreciate you so much. So let's discuss signs, symptoms, and adverse effects of child abuse and prevention too. It's here. Hit the wrong button. Please excuse me. I got different lists here. I would need to make this bigger right here so that you can see the full screen to be able to see. This right here, child abuse and intentional harm or mistreatment to a child under 18 years old is considered child abuse. Child abuse takes many forms, which often occur at the same time. This is from the mayoclinic.org. Physical abuse. Physical child abuse occurs when a child is purposely physically injured or put at risk of harm by another person. Sexual abuse. The child sexual abuse is any sexual activity with a child. This can involve sexual contact, such as intentional sexual touching, oral genital contact, or intercourse. This can also involve non contact sexual abuse of a child, such as exposing a child to sexual activity or pornography, observing or filming a child in a sexual manner, sexual harassment of a child, or prostitution of a child, including sex trafficking. Emotional abuse. Emotional abuse means injuring a child's self esteem or emotional well being. It includes verbal and emotional assault, such as continually belittling or berating a child, as well as isolating, ignoring, or rejecting a child. There's also medical abuse. Medical child abuse occurs when someone gives false information about an illness in a child that requires medical attention. putting the child at risk for injury or an unnecessary medical care. It's y'all seen them cases where a mother has done that and the child ended up deceased. Neglect. Child neglect is failure to provide adequate food, clothing, shelter, clean living conditions, affection, supervision, education, or dental or medical care. It also puts abandonment, leaving your child behind. Going places, just abandon them. That's neglect. In many cases, child abuse is done by someone the child knows and trusts, often a parent or other relative. If you suspect child abuse, report the abuse to the proper authorities. There's a number you can call that's 1-800, the number 4, a child. Y'all in America, write that number down 1-800 4, the number 4, a child. A child who's being abused may feel guilty, ashamed, or confused. The child may be afraid to tell anyone about the abuse, especially if the abuser is a parent, other relative, or family friend. That's why it's vital to watch for red flags, such as withdrawal from friends or usual activities, changes in behavior such as aggression, anger, hostility, or hyperactivity, or changes in school performance, depression, anxiety, or unusual fears, or sudden loss of self confidence, sleep problems and nightmares, an apparent lack of supervision, frequent absences from school, rebellious or defiant behavior, self harm or attempts at suicide. Wow, a lot of them hit close to home with what's happened with me, too. Specific signs and symptoms depend on the type of abuse and can vary. Keep in mind that warning signs are just that, warning signs. The presence of warning signs doesn't necessarily mean that a child is being abused. Because some people can be rebellious or defiant. That doesn't mean that they're abused, such as, physical abuse signs and symptoms. Unexplained injuries, such as bruises, broken bones, fractures, or burns. Oh, I had a lot of those. Back then, they didn't pay that much attention to it, but now they got all these abuse laws. Injuries that don't match the given explanation. Injuries that aren't compatible with the child's developmental ability. Oh, and by the way, back in the 70s, I guess there were some laws that knew that because why else would the school call and report it and the police officer take me back home to dad? And but my dad said, "Oh, she fell in the blackberry bushes." And the cop looked at me. I better not, and warned me that I better not say anything negative about my daddy ever again, or they'll arrest me. So what do you do, y'all? What do you do when you you were threatened by the police that if you tell that your daddy did this to you, we're gonna do something to you again, we'll arrest you. And yet I was being victimized, right? What do you do? So sexual abuse signs and symptoms. Basically, just stay quiet, like I did. Sexual behavior or knowledge that's inappropriate for the child's age. Pregnancy or sexually transmitted infection. Genital or anal pain, bleeding, or injury. Statements by the child that he or she was sexually abused. Inappropriate sexual behavior with other children. Which y'all know that I told y'all some things that had happened to me that I do have injuries still today from that. So, emotional abuse signs and symptoms: delayed or inappropriate emotional development, loss of self confidence or self esteem, social withdrawal or loss of interest or enthusiasm, depression, avoidance of certain situations such as refusing to go to school or ride the bus, appears to desperately seek affection, a decrease in social and school performance or loss of interest in school, loss of previously acquired developmental skills. Like y'all, when I had the injuries sustained from being hit in the head, I can remember being 10 years old, and I really had trouble speaking again after the head injuries because I would say, see the saying go down a sack, trying to say, see the train go down a track. I had to relearn how to speak, and yet I was being mocked from my parent for not being able to talk, and yet he was the one who caused the injuries for me and made it where I had trouble talking. But you know what? Even no matter how much that hurt, I still I still kept kind of like a still a happy child, even though I was being abused. Because guess what? I kept seeing God around, so I kept a smile. I knew He was around there. Yeah, shame on the cops. That's true. But what had happened was a car had backfired that went by the school. So it was like PTSD. I started running. I don't even remember it, but they said they will find me about 2 miles down the road. And I thought it was being shot at again because Daddy used to shoot at me. Okay, welcome back. Welcome back, Chris. Thanks for coming in. So that was my PTSD acting up and running. So I can imagine these kids with these school shootings today. How's this going to affect them the rest of their lives? Every little noise and a bang and a bam, that sounds similar to a car, like even fireworks, bothers me today. So this is bad repercussions of going through a lot of the stuff, like such as. So here's neglect signs and symptoms: poor growth, excessive weight with medical complications that are not being adequately addressed, poor personal cleanliness, lack of clothing or supplies to meet physical needs, hoarding or stealing food, poor record of school attendance, lack of appropriate attention for medical, dental, or psychological problems, or lack of necessary follow up care. And to get back for that story before I go to the next thing so that y'all know, they said that they got this bus drivers and everything to go looking for me. And one bus driver, she usually knew where to find me because I guess I would just keep going down that same path or whatever, and brought me back to the school. And the school ended up calling the police, and the police questioned my siblings, and they're the ones that said that Daddy shot at me. And so they took me to the house, but my siblings were still at the school. And all of a sudden I came to, it's like I was in a little fog still, right? I could not remember nothing that's going on. I don't remember what ever happened at school. I don't remember the bus driver picking me up on the side of the road. I don't remember none of that. I just remember coming up our driveway, and then Daddy being there. Daddy said, "Well, that's not true," and all the bruises and things all over her body is from her falling in blackberry bushes. And so then that's when the cop turned around there and he corrected me, said for me not to lie again. It's like, look, don't lie. I didn't say nothing that I know of, right? I think, I don't know what happened. I don't know how I got here. I don't know why police officers bring me up in here. It's kind of like in shock. You know what I'm saying? I really think I needed medical attention at the time, right? So, parental behavior. Sometimes a parent's demeanor or behavior sends red flags about child abuse. Warning signs include a parent who shows little concern for the child, appears unable to recognize physical or emotional distress in the child, blames the child for the problems. He just makes me so mad. He's the reason why I did it. This child just makes me so mad. How many of y'all have heard that? If you would have just behaved, I would have got so mad. You deserve what happened to you. All this kind of stuff, kids. No, you do not deserve it, okay? Consistently belittles or berates a child and describes a child with negative terms such as worthless or evil. I'll tell you right now, you are not worthless and you are not evil, all right? Expects a child to provide attention and care to the parent and seems jealous of other family members getting attention from the child. Uses harsh physical discipline. Yet demands an inappropriate level of physical or academic performance. Severely limits a child's contact with others. Yeah, that's pretty much true. Offers conflicted or unconvincing explanations for child's injuries or no explanation at all. See, like falling to the blackberry bushes, right? When he used these whips and when he used thick switches, uh, BB guns. You know, I had BB marks all over my body from being hit by the BB pellets, too. Thank God I don't have the repercussions of being actually shot. There was that dust that went all over me when he did that. And then shards of glass as a 2-year old. Luckily, my sister, Sabina, she's the one that told me about it. Um, that she knocked me to the floor and she covered my body when and the shards of glass were going around that my daddy was actually trying to shoot me through the window. So, repeatedly brings a child for medical evaluations or requests, medical tests such as x rays and lab tests, for concerns not seen during the healthcare provider's examination. Child health experts condemn the use of violence in any form, but some people still use physical punishment, such as spanking, to discipline their children. While parents and caregivers often use physical punishment with the intention of helping their children or making their behavior better, research shows that spanking is linked with worse, not better behavior. It's also linked to mental health problems, difficult relationships with parents, lower self esteem, and lower academic performance. Any physical punishment may leave emotional scars. Parental behaviors that cause pain, physical injury, or emotional trauma, even when done in the name of discipline, could be child abuse. I remember I used to spank my kids, and then I said, I'm not going to do that. I'm going to sit them down and talk to them. I went overboard with it. Okay, I gave them a list of W wrongs where we were in a lengthy discussion, right? And they're like, Mama, just go ahead and spank me already. Please, just go ahead and spank me. I'm like, no. I said, no, now I got to start all over. I lost track. Went to see a doctor. If you're concerned that your child or another child has been abused, seek help immediately. Depending on the situation, contact the child's health care provider, a local child welfare agency, the police department, or 24-hour hotline for advice. In the United States, you can get information and assistance by calling or texting the Child Help National Child Abuse Hotline. It's 1-800 for a child. That's what that is right there. The 1-800-422-4453 is the same as 1-800 for a child. That should be easier to remember instead of remembering all those numbers. So it's 1-800 for a child, okay? If the child needs immediate medical attention, call 911 or your local emergency number. In the United States, keep in mind that healthcare professionals and many other people, such as teachers and social workers, are legally required to report all suspected cases of child abuse to the appropriate local child welfare agencies. So here comes the risk factors, y'all. How they get to know? Good to see you. Factors that may increase a person's risk of becoming abusive includes a history of being abused or neglected as a child, physical or mental illness such as depression or post-traumatic stress disorder, family crisis or stress, including domestic violence and other marital conflicts or single parenting, a child in the family who is developmentally or physically disabled, financial stress, unemployment, or poverty, social or extended family isolation, poor understanding of child development and parenting skills, alcohol, drugs, or other substance abuse. There was a time when my dad used to use alcohol, and I think my grandmother said she ended up getting him for drinking because she poured out his alcohol and then got what that's called that they would give them to give them the poops and stuff like that. I cannot remember what that old remedy was. And she filled his bottle with that. And he got sick as a dog and kept going to the bathroom, kept going to the bathroom, kept going to the bathroom. And guess what? He didn't drink again after that. So children overcome the physical and psychological effects of child abuse, particularly those with strong social support and resiliency skills who can adapt and cope with bad experiences. For many others, however, child abuse may result in physical, behavioral, emotional, or mental health issues even years later. Here are some examples. Physical issues, premature death, physical disabilities, learning disabilities, substance abuse, health problems such as heart disease, diabetes, chronic lung disease, and cancer. Now, at times when I was at school, I was more fixated on just survival. And sometimes my schoolwork couldn't be done at home. So it wasn't a matter of learning disability, it's a matter of survival at the time. So behavioral issues, illegal or violent behavior, abuse of others, withdrawal, suicide attempts or self-injury. That means cutting, burning yourself, different other things which will harm yourself. High risk sexual behaviors or teen pregnancy, problems in school or not finishing high school. Well, I was in the second semester of the 12th grade. I kept having a lot of stomach issues. I went ahead and married in the 12th grade because I married early just because I overheard my stepmom talking about killing me, making it look like suicide. So I went ahead and got married to get away from that, from being murdered. And so I kept having stomach issues and I kept having to go to the doctor. And the doctor kept saying, "You need to come back over here." But whenever I would go back to the school, they would say it is unexcused. They would not give me, they said, "Well, you weren't at a doctor." My problem was I went to a doctor that my stepmom had used. So I knew that doctor. But I didn't know that he would end up calling her, and she would end up calling the school and say she's not at the doctor. So they still did the abuse in a weird kind of way by doing that. And that guy should have been in trouble for giving out my information to my stepmom. Limited social and relationship skills, problems with work or staying employed, emotional issues, low self esteem, difficulty establishing or maintaining relationships, challenges with intimacy and trust, an unhealthy view of parenthood, inability to cope with stress and frustrations, an acceptance that violence is a normal part of relationships. A lot of times when you were abused too, and if you get into an abusive relationship like a spouse, you start thinking, well, maybe my mom was right. Maybe I do deserve this. Maybe I am a bad person. You start doubting yourself. So mental health is disorders, eating disorders, personality disorders, behavior disorders, depression, anxiety disorders, PTSD, which is post traumatic stress disorder, and now there's one that's called complex post traumatic stress disorder. Trouble sleeping and nightmares. I don't have nightmares as much, but I still have a lot of difficulty sleeping. Attachment disorder. Now, here's the prevention. You can take important steps to protect your child from exploitation and child abuse, as well as prevent child abuse in your neighborhood or community. The goal is to provide safe, stable, nurturing relationships for children. Here's how you can help keep children safe. Offer your child love and attention. Nurture and listen to your child and be involved in your child's life to develop trust and good communication. Encourage your child to tell you if there's a problem. A supportive family environment and social networks can help improve your child's feelings of self esteem and self worth. Don't respond in anger. If you feel overwhelmed or out of control, take a break. Don't take out your anger on your child. Talk with your healthcare provider or therapist about ways you can learn to cope with stress and better interact with your child. Think supervision. Don't leave a young child home alone. In public, keep a close eye on your child. Volunteer at school and for activities to get to know the adults who spend time with your child. When old enough to go out without supervision, encourage your child to stay away from strangers and to hang out with friends rather than be alone. Make it a rule that your child tells you where he or she is at all times. Find out who's supervising your child, for example, at a sleepover. Know your child's caregivers. Check references for babysitters and other caregivers. Make irregular but frequent unannounced visits to observe what's happening. Don't allow substitutes for your usual child care provider if you don't know the substitute. Emphasize when to say no. Make sure your child understands that he or she doesn't have to do anything that seems scary or uncomfortable. Encourage your child to leave a threatening or frightening situation immediately and seek help from a trusted adult. If something happens, encourage your child to talk to you or another trusted adult about what happened. Assure your child that it's okay to talk and that he or she won't get into trouble. Teach your child how to stay safe online. Put the computer in a common area of your home, not the children's bedroom. Use the parental controls to restrict the types of websites your child can visit. Check your child's privacy settings on social networking sites. Consider the red flag if your child is secretive about online activities. If your child said, well, mom, you never give me space. Well, you can be so nosy about who I'm talking to or what I'm talking to. or who I'm talking to or whatever. It's very important. Stay adamant. Stay in control because they are still a kid. You're an adult. They don't understand a lot of the dangers that's out there in society. They might think who they're talking to is actually a friend of theirs when it might not be. They might think it's a classmate. When a lot of times they say they go to that school and then they'll meet them outside, and guess what? It happens to be an adult and not really another student. We went over it. There was a certain app that the school uses, and you can download it. And most schools use that same app. And this is where some of the predators are coming in and able to go into the schools thing and start seeing the classes where the students are. Even yet, they are not actually a student themselves in that school. They can look and see what classes the students are in, who's all in the classes. This is pretty sickening. This is pretty sickening, y'all, and very alarming too. Because I done had that story about that app and how some of these predators are using it to gain access to our children in the schools and writing them saying that they're a student there too. And that's made up, such and such. So not responding to inappropriate, hurtful, or frightening messages. Not arranging to meet an online contact in person without your permission. Tell your child to let you know if an unknown person makes contact through a social networking site. Report online harassment if inappropriate senders to your service provider and local authorities if necessary. Reach out. Meet the families in your neighborhood, including parents and children. Develop a network of supportive family and friends. If a friend or neighbor seems to be struggling, offer to babysit or help in another way. Consider joining a parent support group so that you have an appropriate place to vent your frustrations. If you worry that you might abuse your child, if you're concerned that you might abuse your child, seek help immediately. In the United States, you can get information and assistance by calling or texting the Child Help National Child Abuse Hotline, 1 800 for a child, 1 800 422 4453. Or you can start by talking with your family healthcare provider. Your provider may offer a referral to a parent education class, counseling, or support group of parents to help you learn appropriate ways to deal with your anger. If you're misusing alcohol or drugs, ask your healthcare provider about treatment options. If you were abused as a child, get counseling to ensure you don't continue the abuse cycle or teach those destructive behaviors to your child. Remember, child abuse is preventable and often a symptom of a problem that may be treatable. Ask for help today. So, without further ado, let me go to the next page over here. Now, here's the signs and symptoms of abuse, neglect, behavioral clues. Infants, excessive crying or developmental delay. Fear, anxiety, clinging, which I know in a lot of kids, they don't know somebody. They ain't going to want to go. Don't force your kid to go hug a relative they hadn't seen that they don't really know. And sometimes they might really know somebody and you force them to hug. That person could have easily touched them inappropriate and you don't know that. But again, please don't force them into hugging if they don't want to, okay? Phobias, nightmares, sleeping problems, bedwetting, social withdrawal, hyperactivity, poor concentration, distractibility, decreased school performance, chronic school absenteeism, speech disorders, regressive behavior for age, seems afraid of parents, eating issues, depression, passivity, increased verbal abuse or physically aggressive behavior with others, destroys or injures objects or pets, substance abuse, self-harm, such as cutting, sexualized behavior, symptoms of PTSD, which is post-traumatic stress disorder, avoidance of addressing. I was very nervous when we had to address a PE. I did not like the fact about having to address in front of others. So I just hung around till most of the people were gone up. That's what I would address. Withdrawal to touch, afraid of exam, overly compliant, especially with difficult or painful parts of the exam. Because symptom clues, headaches, abdominal, uh, sorry, abdominal, pain, chronic, abdominal pain, acute, blunt trauma that may not show external marks. Look for distension, tenderness, absent bowel sounds, vague somatic complaints, often chronic, worsened medical problems such as asthma, frequent unexplained sore throat, abnormal weight loss or gain, reluctance to use an extremity like an arm or leg, difficulty walking or sitting, genital discomfort or painful urination or defecation, unexplained symptoms. Look for poisoning, forced ingestion of water, salt, Munchausen by proxy. Vomiting, irritability, or abnormal respiration may present head trauma. Wow. So some of the things with my respiratory as a little girl could also have been being hit in the head. Wow. Physical clues, most common manifestations of abuse are found for skin, bone, or CNS. Poor hygiene, dressed inappropriately for weather. Have y'all seen the kids that wear shorts in the wintertime and when it's cold and snowy and ice outside? Failure to thrive, poor weight gain, malnutrition, lack care and medical needs, wound care, medication. See fractures, dislocations, bruising, defensive injuries on forearms, like if somebody's trying to hit them and then they put their arms up to try to protect their face or their head or something, and then you'll see the bruising and the defense injuries, which could be um, marks, it can be from cuts, it can be from belt marks all over their arms, anything. Bites. Human bites are more superficial than animal and show up better 2 or 3 days later. Burns. And 6 to 20% of abused children, cigarette, rope, immersion, or shape of hot object. I want to tell y'all about something which I have been thinking about lately. Used to, my stepmom would say, you and your twin sisters, y'all like to try to sit on the coal oven. What kid at 4 years old will really want to get that severely burned and want to sit on a coal oven? And she said that me and my twin would sit on it. Thing about it is, okay, you're 4 years old, you'll have to have help getting up there on a coal oven, right? So there were no burns on her hands whatsoever. The only burns that we had that were severe was on our buttocks. Because she said we would put ourselves and sit up there. But there's no way a 4 year old would have been able to get up there and sit down without using her hands to pull herself up on it. It does not make sense. So we come into that realization about being placed on the hot iron stoves. I am thankful to God that it's not like it healed. Thank God it healed. It's His grace and mercy. It's healed. Is the severity of the burn consistent with length of contact by history? Cigarette burn circular, 8 to 10 millimeters deep, heat margin may be confused with impetigo or moxibustion. Yeah, we had a lot of impetigo at times, and they said that because we scratched, but we know better than that. A lot of things was from the injuries, and then we started scratching because it was itching. We had impetigo. Stun gun burns occur in pairs with 5 centimeter diameter and 5 centimeter apart. Emergent burns have sharp line of demarcation without drip or splash marks. So basically, that is the kind of burns like if you're immersed in hot water. Signs of restraints or eczema or extremities. Trauma to the ear, lacerations, traumatic hair loss, facial injuries without good explanation, oral dental injuries such as torn or bruised frenulum, lips, teeth, palate, tongue, or oral mucosa. Injuries for non-ambulatory child may be bottle jamming. Lacerations or tissue damage to oral structures may come from eating utensils, scalding, or caustic liquids. Scar and bruising at corners of mouth from being gagged. Wow. Oh man. Oh man. I used to have a lot of bruising and stuff at the corners of my mouth, and I didn't know where I got them from. Now a lot of that is, which some of y'all know, some things that I haven't come out about. So wow, I had that bruising at the corners of my mouth, oral injuries, STDs from forced oral sex. And I would say, yeah, I had a nose. I got a scar across my nose because my dad used a pair of pliers and twisted my nose. And so uh, sometimes I have to go back and have surgery to repair that because it keeps twisting and blocking up that side of the nose since he did it during the growing years. So head injury, mental status change, retinal hemorrhage, subdural hematoma, intra-abdominal trauma, usually to multiple organs, bruising, tear, bleeding, discharge from genital or rectal area, diagnosis T or pregnancy. Whew. Wow, wow, wow. And over here, it's got the warning. Parents may seem evasive or inconsistent in their stories due to language or cultural differences, or to being embarrassed or afraid relating to some other issues. Cultural language difficulties may also lead to delayed care. What are age appropriate normal sexual behaviors? We didn't go there. Children may be injured by domestic violence. Via being too small to get out of the way. Trying to intervene. Like that one story I said about that 5 or 6 year old girl, and it's in my book, where the boyfriend was fighting with the mother, and so the little girl went up to the boyfriend and tugged his shirt and begging him to stop fighting. He backhanded her, and it sent her body down a flight of stairs. And this was in Texas a lot of years ago. There's becoming an object of abuse, being neglected by the abused parent, who may be focused on their own fear or depression. Red flags with injuries. Explanation doesn't fit the injury as a pattern, timing, or developmental ability of child. The explanation keeps changing. The story keeps changing. Child is consistently blamed as cause of repeated injuries. Significant injuries attributed to a young sibling. Delay in seeking medical care. History of multiple ED visits. So you're going over there and have to go to the emergency department. Frequent change of primary care provider. Also frequent moving. That's what we did a lot. We frequently moved. Parental risk factors. Rigid, severe discipline. Strongly responds to negative behaviors. Ignores child's positive behaviors. Ridicules child in public. Isolates a child socially or from other family members. Seems overprotective or jealous. Unrealistic expectations of child development or behavior for age. Parent is caregiver for child with significant cognitive, physical, or emotional disabilities. Child unwanted, unplanned. Lack of emotional interaction with child. Inappropriate over or under concern about injury. Partial confession. Depression. Difficulty controlling emotions, especially anger. Substance abuse. Teen parenthood. Family stress such as divorce, job loss. So, does anybody got any questions or any statements about what we had read? I'll go. There was something else I had seen earlier too on. Oh, er, so a lot of people can have fibromyalgia. Let me go over here. See if I can find it right here. Sorry. So there's toxic stress. There's positive stress that's good and helps a child grow, but when it's toxic stress about child abuse, that is not good at all. Okay, so that link did not help too well. So let me go to share this too. Share the screen with y'all. So here's some key facts right here. 6 in 10 children, over 400 million children under 5 years of age, regularly suffer physical punishment and or psychological violence at the hands of parents or caregivers. You see that? 6 in 10 children or 400 million children. This is the WHO. See if it's got a date. I do not see a date. Oh, this is November the 5th, 2024. So this is a recent article. Red information. There's so much cover on abuse. It's good to remember red flags. Yes, it is. Thank you. So 1 in 5 women and 1 in 7 men report having been sexually abused as a child. That's just some of the people that's reported. There's some people that still have not reported. Okay. There's so many people that just let it slip by. They don't want to go into it. They don't want to open up what is said a can of worms, is what they say. Consequences of child maltreatment include impaired lifelong physical and mental health, and the social and occupational outcomes can ultimately slow a country's economic and social development. Child maltreatment is often hidden. Only a fraction of child victims of maltreatment ever get support from health professionals. A child who is abused is more likely to abuse others as an adult so that the violence is passed down from one generation to the next. I know a lot of others who beg to differ about that. So a lot of people that have been abused are had changed it around because they don't want to harm their kids. They don't want to do to their kids what had been done to them. So preventing, and if you use that excuse, oh, I abused my child because I was abused, that's not an excuse. You're an adult. You have a choice. Don't do it. Do not harm a child. Preventing child maltreatment before it starts is possible. Effective prevention approaches include supporting parents, teaching positive parenting skills, and enhancing laws to prohibit violent punishment, such as, like when a parent is feeling so stressed, they got the parental network of other friends around, right? So let's get together and let's have parenting in that neighborhood or environment. Some safe people you could trust, that they trust you. If they feel like they're overwhelmed, well, let them you take care of their child for a little bit while they get de-stressed, or have it to a family member they live nearby. Anything like that, think of different ways. You're not in it alone. There are a lot of people who care. Overview: child maltreatment is the abuse and neglect that occurs to children under 18 years of age. It includes all types of physical and/or emotional ill treatment, sexual abuse, neglect, negligence, and commercial or other exploitation, which results in actual or potential harm to the child's health, survival, development, or dignity in the context of relationship or responsibility, trust, or power. Scope of the problem: child maltreatment is a global problem with serious lifelong consequences. In spite of recent national surveys in several low and middle income countries, data from many countries are still lacking. Child maltreatment is complex and difficult to study. Current estimates vary widely depending on the country and the method of research used. Estimates depend on the definitions of child maltreatment used, the type of child maltreatment studied, the coverage and quality of official statistics, the coverage and quality of surveys that request self reports from victims, parents, or caregivers. Nevertheless, international studies reveal that 6 in 10 children under 5 years of age regularly suffer physical punishment and or physical psychological violence at the hands of parents and caregivers. And 1 in 1 women and 1 in 7 men report having been sexually abused as a child. People, if you get so mad at your child, please don't tell them, I wish you were never born. Please don't tell them you are a mistake. Please don't tell them you can do nothing right. All you do is wrong. Please don't tell them you're always a bad child. Please don't all that negative feedback. How can you do a child better? Give them positive feedback. Give them show them like everybody makes mistakes. Let's think of a different way to handle this situation. I know that you're bored or something, so let me get you involved in color. Sit down right there, coloring. Let me get you some building Legos or something like that. Take your time and work on some Lego. Get the kid busy a lot of times when you're before you go in there to start cooking, where they won't be underfoot, where they won't be aggravating you. Get them interested in something else, you know, uh, where you don't have to worry about that kind of thing. Just just know that a child is a gift from God. It's not somebody to be abused. You would not like it if somebody told you you're a mistake. You would not like it to hear that you're not loved, you're not wanted, you can do nothing right. Imagine the impression it does to a little child, their brain, right? It takes so long when you get to replace the negativity with the positivity. Just because you might go later, oh, I'm sorry, I said that. That's not going to go away from the kid's brain. It takes so many attaboys, as Dr. Phil would say, takes so many attaboys just to rule out and get rid of all the negativity of just one statement. It takes a lot. But you do not want to continue doing that, or they're going to end up in worse shape. You want to bond with your kid. Kids are very fun, and they're special. I love it, that one-on-one time with the kids. Every year, there are an estimated 150 homicide deaths in children under 18 years of age, some of which are likely due to child maltreatment. This number almost certainly underestimates the true extent of the problem, since a significant proportion of deaths due to child maltreatment are incorrectly attributed to falls, burns, drowning, or other causes. In all conflict and refugee settings, girls are particularly vulnerable to sexual violence, exploitation, and abuse by combatants, security forces, members of their communities, aid workers, and others. Tell y'all something. If y'all just want to get rid of your child because, oh, I got a new guy in my life, so he don't want a child. Do you know how many people there are out there that want a child and cannot have a child? If you don't want your child, there are plenty of other people who would love the opportunity to raise a child. Think of that. Find somebody maybe that you know, somebody you trust. In armed conflict and refugee settings, like we went over that, consequences of maltreatment. Child maltreatment has often severe short and long term physical, sexual, and mental health consequences. These include injuries, include head injuries and severe disability, in particular in young children, post traumatic stress, anxiety, depression, and sexually transmitted infections, including HIV. Adolescent girls may face additional health issues, including gynecological disorders and unwanted pregnancy. Child maltreatment can affect cognitive and academic performance and is strongly associated with alcohol and drug abuse and smoking. Key risk factors for non communicable diseases, such as cardiovascular diseases and cancer. Now, like I said, when I was a teenager, I remember in particular, I was sitting on the couch and I stood up to go to the bathroom. My stepmom said, hold on. My stepmom told me to sit down, that I didn't ask if I could be excused to use the bathroom. Here was 15-year old. Her kids didn't have to ask, but I had to ask, right? But anyway, I sat down and said, may I please be excused to use the bathroom? She said, yes, you may. So I stood up to go to the bathroom. She said, sit back down. You didn't ask me which leg I wanted you to walk first to step on to start walking to go to the bathroom. So I had to sit back down. I said, Mom, I'm sorry. I said, what leg do you want me to use for me to start off to walk to the bathroom? So she told me, and I almost stood up again, but then I had to remember I had to re-ask her again if I could be excused to use the bathroom. So that kind of control, you're not thinking logically, you are kind of like a robot in the house. And I tell you, it takes a lot to get out of that mindset of being able to think for yourself, if y'all know what I mean there. Some kids are not able to be in environments where they can't think. But I thank God we lived in the country. I thank God I loved going out back in the woods and I communed with God. So she didn't take all that away from me. That walk with God, that fresh air, that did a world of good to me. The maltreatment causes stress that is associated with disruption in early brain development. Extreme stress can impair the development of the nervous and immune systems. Consequently, as adults, maltreated children are at increased risk for behavioral, physical, and mental health problems such as perpetrating or becoming a victim of violence. Okay, that's pretty true. Becoming a victim of violence, depression, smoking, obesity, high risk sexual behaviors, unintended pregnancy, alcohol or drug use. I want to tell y'all, when I was a teenager, I was accused of being fat. And so I ended up getting some Dexatrim. I said, well, and Dexatrim is not really good for you. And so I took one. So next day I said, figured like if one could do the trick, maybe I could take two at once. And I went ahead and took two, thinking that, this is going to be better for me. And I took two, and you talk about being sick as a dog, that high level, and I didn't know that it was speed. And then years later, my husband, he got me to try weed, and all I did was like two or three times, but I didn't like it. I tried alcohol, but I tried to smoke, thinking, okay, that would help me de-stress. They kind of found out I was allergic to it, so I couldn't smoke it. So I gave away the pack of cigarettes. And then I tried alcohol as a way to get, and I wanted to end up forgetting, right? I wanted to, my best to forget the pain. I didn't want to feel all this and see all this that I was seeing, okay? So the bad thing is, yeah, I drank, but guess what? I couldn't forget. All I could do is see myself and stammered around, falling to the left, falling to the right. I'm like, this is so embarrassing. Here I am falling around crazily. I said, alcohol ain't working for me because I still remember. And then I'm shown, you know, as being a drunk or something like that just for being a little high on the alcohol. I'm like, no, it's not for me. This is not the answer. So I thank God that I wasn't able to forget, or that would have been a remedy that I probably would have kept doing. So I thank God that it didn't work for me. So risk factors. Several risk factors for child maltreatment have been identified. Not all risk factors are present in all social and cultural contexts, and the list here provides an overview for attempting to understand the causes of child maltreatment. It is important to emphasize that children are the victims and are never to blame for maltreatment. Exactly. Characteristics of an individual child that may increase the likelihood of being maltreated include being either under 4 years old or an adolescent, being unwanted or failing to fulfill the expectations of parents, having special needs, crying persistently, or having abnormal physical features. Yeah, I might have cried some, as a 4 year old, but don't go and hit a kid across the room or don't do these physical injuries where it's going to hurt a child trying to make it do adult things such as sexual exploiting them, cutting them, selling them sexually. Don't go and do these behaviors if you don't want a kid to cry. Treat a kid right, and I bet you they'll be a lot better of a child. Having an intellectual disability or neurological disorder, identified as or being identified as lesbian, gay, bisexual, or transgender, parent or caregiver. Characteristics of a parent or caregiver that may increase the risk of child maltreatment include difficulty bonding with a newborn. I think my mom cannot bond with me, and that's okay. Not nurturing the child, having been maltreated themselves as a child, lacking awareness of child development or having unrealistic expectations, misusing alcohol or drugs, included during pregnancy, having low self esteem, suffer from poor impulse control, having a mental or neurological disorder, being involved in criminal activity, experiencing financial difficulties. So here's characteristics of the relationships within families or among intimate partners, friends, and peers that may increase the risk of child maltreatment include family breakdown or violence between other family members, being isolated in the community or lacking a support network, and breakdown of support in child rearing from the extended family. So, community and societal factors. Characteristics of communities and societies that may increase the risk of child maltreatment include gender and social inequality, lack of adequate housing or services to support families and institutions, high levels of unemployment or poverty, the easy availability of alcohol and drugs, inadequate policies and programs to prevent child maltreatment, child pornography, child prostitution, and child labor. Social and cultural norms that promote or glorify violence towards others, support the use of corporal punishment, demand rigid gender roles, or diminish the status of child and parent child relationships. A lot of times, some parents try to get the child to take care of them when it's actually the parent that needs to be there and help the kid. Like if you want a kid to clean up the kitchen, how about going in there and helping them do the kitchen with them? It depends on the age. You just don't go and all say, pick up that, do that, do that, do that. But you got to be an inspiration to the kids. How I did my kids, I would go in there and help them pick up the toys in their rooms and show them where everything goes. That made it quicker. That made it, they were right there and they would know the gist of it by my example. Just by going by an example of how I do it, they were able to see how to go about doing it in a proper way. And they ended up starting picking up their room all the time automatically without me having to tell them. They enjoyed a clean room. They were so proud of it. Prevention. Preventing and responding to child maltreatment requires a multi-sectoral approach. The earlier such interventions occur in children's lives, the greater the benefits of the child cognitive development, behavioral and social competence, educational attainment, and to society. Reduce delinquency and crime. Effective and promising interventions include parent and caregiver support, information and skill building sessions to support the development of nurturing, nonviolent parenting delivered by nurses, social workers, or trained lay workers through a series of home visits or in a community setting. Education and life skills approaches, increasing enrollment in high quality education to allow children to acquire knowledge, skills, and experiences that build resilience and reduce risk factors for violence. Programs to prevent sexual abuse that build awareness and teach skills to help children and adolescents understand consent, avoid and prevent sexual abuse and exploitation, and to seek help, support, and interventions to build a positive school climate, a violence free environment, and strengthening relationships between students, teachers, and administrators. Y'all, there is a program online, and you can even look up a video at YouTube. It's called My Body is My Body. So they got a program that's even my body's my body. That's online. You go through the training program, whatever. But I think it's very important in teaching your kid that it's okay to say no. What's the wrong kind of touching, and such as, right? The norms and values approaches programs to transform restrictive and harmful gender and social norms around child rearing, child discipline, and gender equality and promote the nurturing role of fathers. Implementation and enforcement of laws to prohibit violent punishment and to protect children from sexual abuse and exploitation. Response and support services, early case recognition coupled with ongoing care of child victims and families to help reduce reoccurrence of maltreatment and lessen its consequences. How many of these times we have seen these? It's kind of weird how CPS returns some kids who the parents haven't really done that much anything wrong, but it was a false um, investigation, basically. And then there's been some who's been violent, been doing drugs, abuse a child, and CPS sends the kids back to that mother. Next thing you know, the child is dead. For that, I blame CPS for doing that, returning the child in a danger to welfare. To maximize the effects of prevention and care, WHO recommends that interventions are delivered as part of a four-step public health approach. Defining the problem, identifying causes and risk factors, designing and testing interventions aimed at minimizing the risk factors, and disseminating information about the effectiveness of interventions and increasing the scale of proven effective interventions. The WHO, in collaboration with partners, provides guidance for evidence-based child maltreatment prevention. C. Inspires 7 strategies to end violence against children. Provides evidence-based guidance to help frontline healthcare providers recognize children who have suffered from violence and neglect and provide evidence-based first line support. She responded to child maltreatment, the clinical handbook for health professionals. Advocates for increased international support for an investment in evidence-based child maltreatment prevention and provides technical support for evidence-based child maltreatment prevention programs in several low and middle income countries. So let me go to this Inspire. So here's the overview. This is Inspire 7 Strategies for Ending Violence Against Children. This is WHO.int for international. 7 strategies for ending violence against children. A select group of strategies that have shown success in reducing violence against children. They are implementation and enforcement of laws, norms and values, safe environments, parent and caregiver support, income and economic strengthening, response and support services, and education of life and life skills. There, right there, will be you able to hear uh, other languages related link. That's this. So I need to go ahead. Let's see a video right here. So give me a second. I would have to mute my mic when I get past this commercial. Get it to load up. That is. Okay, so let me pause the video. Let's get my settings here. Change the audio. Y'all will not be able to hear me, okay?
Greetings. Thank you for being with us today. My name is Sabine Rakotomalala from the Global Partnership to End Violence Against Children.
And my name is Alex Butchart, Coordinator for the Prevention of Violence at the World Health Organization in Geneva. What we'd like to do in this presentation is to introduce the Inspire 7 Strategies for Ending Violence Against Children technical package. We're delighted to be able to do this and to have all of you here because it demonstrates a sign of real intent to make a difference. And we must make a difference. Globally, an estimated 1 billion children, or every second child, suffer some form of violence each year. Homicide is among the top 5 causes of death in adolescence, with boys comprising some 80% of victims and perpetrators. For every homicide, hundreds of mainly male victims sustain injuries as a result of youth violence. 1 in 4 children suffer physical abuse, and nearly 1 in 5 girls and 1 in 10 boys is sexually abused. There are 6 main types of violence, and these occur at different stages in a child's development. Child maltreatment, usually at the hands of parents, caregivers, and other authority figures, occurs during infancy, childhood, and adolescence, often in schools, in homes, and in orphanages. Bullying often takes place in schools and is typically between children who know one another, and it also occurs online. Youth violence occurs among children aged 10 to 17 years. It involves physical assault with weapons and can involve gang violence. Intimate partner violence occurs against girls within child and early or forced marriages, and among romantically involved adolescents is often referred to as dating violence. Sexual violence includes forced sex and non-contact sexual violence such as harassment, and emotional violence or psychological violence includes restricting a child's movements, ridicules and threats, and witnessing violence between parents. Violence against children can have acute and lifelong health consequences. Injuries, which can result in death and disability, health risk behaviors such as smoking, alcohol and drug abuse, unsafe sex and violence, mental health problems, including suicide, maternal and child health problems, and via these, communicable diseases such as HIV and non-communicable diseases such as cancers, cardiovascular disorders, and diabetes. As such, violence against children is a significant problem in itself and a major risk factor for many top priority public health conditions. Ending violence against children, or more realistically reducing its prevalence, demands collective action, and the Inspire technical package is intended to help us go from this, where separate stakeholders are moving in different and even opposite directions, to this, where all stakeholders are moving in the same direction to achieve prevention effects bigger than the sum of their individual contributions. Inspire, 7 Strategies for Ending Violence Against Children, is a technical package made up of 3 publications. Each letter of the word Inspire stands for a strategy. I for implementation and enforcement of laws, N for norms and values, S for safe environments, P for parent and caregiver support, I for income and economic strengthening, R for response and support services, and E for education and life skills. The core document shown here sets out what we can do to prevent violence against children. In the core document, each strategy includes evidence-based interventions organized into different approaches and highlighting which sectors should be involved. A section on cross-cutting components emphasizes the importance of monitoring intervention uptake and effectiveness. And a final section summarizes issues to consider around implementation, which is more fully dealt with in the handbook. The Inspire vision is a world where all governments, with the strong participation of civil society and communities, routinely implement and monitor evidence-based, multi-sectoral interventions to prevent and respond to violence against all children and help them reach their full potential. This vision statement contains three key concepts: evidence-based, which means using what science has shown to be effective; multi-sectoral action, since we can only make a difference by working together; and prevention. 6 of the 7 strategies are about prevention, and 1 concerns response. You can get more information on these concepts in the Inspire documents. And now over to Sabine.
Thank you, Alex, for this introduction. The next set of slides describes some of the evidence-based strategies mentioned in Inspire. The first one is on implementation and enforcement of laws. Laws that criminalize violent behavior are important for deterring potential perpetrators, but just as important are laws that address risk factors, such as firearms. In this example, introduction and enforcement in South Africa of the Firearm Control Act saved over 4,500 lives, including many adolescents, across 5 years in South Africa's main cities. As you can see, firearm homicides declined much more than non-firearm homicides. The second strategy is strengthening norms and values. Strengthening norms and values that support nonviolent relationships is about changing the idea that forms of violence are acceptable. Children witnessing domestic violence between parents is one of the ways by which such violence is normalized and increases the chance for these children to commit violence themselves. Interventions that prevent intimate partner violence are thus important in preventing violence against children. SASA, a community mobilization program developed in Uganda, reduced intimate partner violence by 52% and is estimated to have decreased the proportion of children who witness such violence by 64%. The third strategy is safe environments, one that we often forget. Safe environment focuses on modifying the social and physical environment to foster positive behaviors. For example, the Cardiff model reduced hospital admissions for violence-related injuries by 42% and police-recorded injuries by 32%. The intervention involves combining data from hospital emergency departments as well as from the police in order to identify hotspots where violence occurs, such as bars, nightclubs, or other gathering places. And then with community workers intervening to reduce the risk factors in these settings. The fourth strategy that we look at is parent and caregiver support. Parenting is key for children. Parenting programs generally aim to reduce harsh parenting practices and create positive parent-child relationships. Support can be delivered through home visits or in groups, where parents discuss their children's development and learn how to adopt positive parent practices. In the USA, the Nurse Family Partnership Program led to a 48% reduction in child maltreatment. Income and economic strengthening. This entails providing cash transfers, often together with parent training or education on gender norms. By way of example, Image, presented here, pairs microfinance with education on HIV/AIDS, gender norms, and domestic violence. A trial of Image in South Africa found that it reduced intimate partner violence by 50% among women in villages that received the intervention. As noted earlier, this will have reduced the proportion of children witnessing domestic violence, and with that, the likelihood of their subsequent involvement in violence. Children who've experienced violence may require access to good quality health care, social welfare, and criminal justice support services. These can help to break the cycle of violence in children's lives and helps them to recover if violence has occurred. Trauma-informed cognitive behavior therapy is one intervention mentioned in Inspire. A review of 11 trials found that it reduced trauma symptoms and functional impairment among children and adolescents exposed to violence by 37% when delivered to individual children, and by 56% when delivered in a group format. Lastly, the E of INSPIRE, which stands for education and life skills. Gains in education protect against victimization and perpetration of violence. This strategy involves approaches such as increasing school enrollment and providing life and social skills trainings in schools. A review of hundreds of life and social skills training programs found that they reduced aggressive and abruptive behavior in school settings by 25% when they were delivered to all students, and by 33% when they were targeted to high-risk students. I'll hand over to Alex to continue the presentation on what we can do and how we should be doing it.
Thanks very much, Sabine. Moving from the core document on what we can do to prevent violence against children, the handbook shown here provides detailed information on how to implement the package. The 7 strategy chapters help users to choose between the different interventions based on their fit with their existing resources and the prevailing risk and protective factors. To do this, it explores the following questions. What can I and what should I do in my context? What are the core intervention components? What will it cost and what will it save? What human and other resources are required? Where can I get more information? And how do I know if it's working? Each strategy-specific chapter ends with an implementation worksheet. This guides users through the process of choosing interventions that are appropriate to their context. It covers the assessment of existing interventions in the current environment, intervention selection, partnership building, resource needs and costs, adapting approaches to the local context, and planning for monitoring and evaluation. The third and final component of the INSPIRE technical package addresses the key area of monitoring, and it's the indicator framework shown here. The document provides 3 sets of indicators: output indicators, outcome indicators, and impact indicators. There are 4 to 6 indicators per strategy, 10 that cover exposure to violence, and 2 each on cross-cutting issues. There's no requirement to use all the indicators. Wherever possible, the indicators are based on existing questions from widely used surveys, such as the Global Schools-Based Student Health Survey, the UNICEF Multiple Indicator Cluster Survey, and the Violence Against Children Survey. For each indicator, there's information about its purpose, possible data sources, sample questions, and how to calculate it. To conclude, it's over to Sabine once more.
Efforts to enhance programs and policies within a country are really strengthened by supportive international partnerships. The Global Partnership to End Violence Against Children was launched in 2016 and promotes uptake of INSPIRE as the way ahead in its pathfinding countries. To conclude this overview of INSPIRE, it's helpful to list 5 key elements that underlie effective collective action, as identified through reviews of several successful public health communication initiatives. These are, firstly, a technical package, secondly, monitoring, thirdly, partnerships, fourth is communication, and fifth is political commitment. We hope that by 2030, as a global violence prevention community, we can look back at our achievements. We hope that we can monitor uptake of INSPIRE. We hope that we can show that we've been able to communicate with one voice. And most importantly, that we can show that we've achieved collective impact towards Sustainable Development Goal 16.2 to end all forms of violence against children. I really want to thank each and every one of you for being here today, for listening. Only together will we be able to make an impact in the lives of children around the world. For more information, please don't hesitate to download materials on the website here mentioned. And I thank you for your collective action to end violence against children.
I hope this information helps others to see, gives them inspired technical package. Let me see. I might go ahead and try to restart the page there. Present. Let me show y'all something here right quick. Don't want to change over to it right now. It's giving me a bug. So we go right here, and it's got the indicator guidance and results framework. Action on implement the 7 strategies. The Inspire indicator guidance and results framework is right here. And you could download the PDF, which I have downloaded now. Let's see how this looks. And the balance against children, how to define, so you're able to measure change. So yeah, this is from, we're able to get the booklet. Soon. Let's go on down. Abbreviations and acronyms. I like it for the fact that having the acronyms too are there. Health behavior in school age children. Living standards measurement survey. Multiple indicator cluster survey. Such and such as that. So with a glossary, it talks about inspired strategies, core indicators, levels of indicators, criteria used to select core indicators, who should use these indicators, and how to obtain data for the core indicators, areas for further development. So we go on down, let's scan this a little bit more. Wow, I like this right here. Violent discipline impact goal indicators that measure prevalence of violence. So let me check out 1 violent discipline by caregivers past month. We'll see what kind of happens. Physical punishment by teachers past 12 months. Lifetime sexual violence in childhood by any perpetrator. I'm trying to go to page 32. Physical attack against adolescents past 12 months. Child homicide rate. It seems like there's a lot of things to study in here. Monitor and evaluation national prevalence estimates for key forms of violence against children and adolescents. So let me go to see if it's going to be easy to go to or not. 45. I know it's got. So we're already on 31. See how it looks when we go to what I'm looking for right now. Oh wow, went a little bit too far at 63. There's 43. So we're going to hear, well, this is child homicide rate indicators. And its purpose is changes the levels of lethal violence against children and adolescents. It goes on and talks about the method of computation, links to online data. I like that, having a link to the national homicide estimates of all ages for 170 plus countries are available. There's a global database as well on here for people that's interested in getting this booklet. Child exposure to households affected by physical partner violence against women. It's got, this has got chock full a lot of good information here. Let's see, global database for UNICEF uh, such as key method of computation limitations. And here's implementation and enforcement of laws. Yeah, laws protecting children from physical punishment, violent punishment. So here, right here, indication. I like this one right here. 3.2 laws protecting children from sexual abuse and exploitation. Alignment of the national legal framework with key international standards regarding the criminalization of child sexual abuse and exploitation and protection of child victims. Inspired strategy, implementation, and enforcement of laws. Uh, Intended result, intermediate outcome. Countries have strengthened implementation and enforcement of laws and policies that protect children and adolescents from violence, reduce excessive alcohol use, and limit youth access to weapons. There's the purpose. Let's go to this operational definition here. For United Nations member states that have ratified the Convention of the Rights of the Child, the CRC, and the optional protocol of the sale of children, child prostitution, and child pornography, OPSC. Existence of laws that are aligned with key international standards such as those established by the CRC and OPSC. So, number one, and it says follows criminalizes sexual assault, penetrative and non penetrative, against girls and boys using coercion, force, threats, or abuse of the position of trust, authority, or influence over the child, with no exceptions. So, police officers, guess what? Here we go. Judges, people in power, governors, senators that's doing all this stuff. You're in power, but guess what? You're not above the law. Criminalizes sexual activities, penetrate and non penetrative, with girls and boys under specified legal age of sexual consent. Legal age of consent is established by national law. Criminalizes offering, delivering, procuring, or accepting a child for the purpose of prostitution, production of pornography, child sex abuse material, and any other form of sexual abuse or sexual exploitation, as well as possessing and distributing child pornography, child sexual abuse material. So what's going to happen down here? Let's see. Sample measurement tools and questions. It includes for the operational definition above, such as the following acts covered under the criminal law: engaging in sexual activities with a child under the legal age of consent, engaging in sexual activities with a child using coercion, force, or threats, abusing a position of trust, authority, or influence over the child, offering, delivering, or accepting a child for the purpose of sexual exploitation, offering, obtaining, procuring, or providing a child for child prostitution, producing, distribution, disseminating, importing, exporting, offering, selling, or possessing child pornography. Right here says UNODOC, Documents, Justice, and Prison Reform, ebook. And say allow. Let's see what's going to happen. Yeah. So now I got this booklet here, Elimination of Violence Against Children, Prohibition of Violence Against Children. Let's get this green over here a little bit. So, how to use the checklist, contents, bookmarks. So I think it's better if I did it that way to put the X out of there so we look at it going through here. Try to make it a little bit bigger so we can see. Okay. This is prohibition of violence against children, general prevention, enhancing the ability and capability of the criminal justice system to respond to violence against children and protect child victims, preventing and responding to violence. There's a structure of a checklist here. setting priorities, how to use a checklist, do, best practices, monitoring. If y'all would like me to go over this book sometime, please put a 1 in here. Prohibition of violence against children, general prevention. So ensuring the prohibition by law of all forms of violence against children. Wow. There's also prohibition of harmful practices. It actually does. What? Seriously? Did you see that there? Okay, I had female genital mutilation of cutting, but here's forced marriage. We already went over that. We know that there's forced marriage. But y'all, breast ironing? Witchcraft rituals. Wow, 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 wow. Yeah, I definitely think that we need to be going over this little booklet here, don't you? Wow. All right. Thanks everybody for coming. I say God bless y'all. I think we got some tips, signs, symptoms, and adverse effects of child abuse prevention tips. And we found a little bit more information out there. I want to thank y'all so much and God bless you. Please like, subscribe, and share. Thanks everybody who came. It's nice to see y'all.